Healthcare disparities touch more than half of us. If you're a member of a minority group, if you are older than the age of 65, if you're overweight, many of us end up having some sort of disparity in how we receive healthcare and our outcomes after we are treated for some sort of condition. And this kind of healthcare inequity is just deplorable. All of us should have the chance to get and receive the best possible care. And all of us should have the opportunity to really get the best possible care and have the best possible outcome. In fact, Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and most inhumane. So we can't let that happen in America still. And we need to make a difference. And that's why healthcare disparities are so very important. And we need to get rid of them. Well, there are many different ways to address healthcare disparities. Perhaps the first thing that we've done is to really identify healthcare disparities. So we're like in the first phase of understanding how many patients are at risk and what is the real scope of disparities and where they lie. In our work, we've shown that an area where you think that there would not be any disparities, that everybody gets the same care, is care after being injured. You know, the emergency room has long been thought to be the equalizer, that everybody who comes in ends up getting the same care. I happen to work in emergency rooms a lot of the time. I'm a trauma surgeon, and we take care of people who get injured from a car crash or from being shot due to urban violence. And you know, we feel, or we hope at least, that we give everybody the same best possible care. But in our own research, we've shown that that somehow doesn't translate to equal outcomes for everybody. And it turns out that patients who happen to be black, or who happen to be Hispanic, or who happen to not have insurance, somehow they end up having much worse outcomes compared to people who have insurance, or compared to people who happen to be white. That's not right. And we need to figure out why this is happening. A lot of people are trying to figure this out, though, by the way. You know, trying to understand the underlying mechanisms of where disparities come from is the focus of research of not just my group, but many, many other people. So I think all of us need to be involved in addressing healthcare disparities. If you work in a big company or work in the government, knowing about healthcare disparities and what kind of patients and who amongst your colleagues are at risk for some sort of disparities or differences in outcomes is very good to know, because if you know that, you can help them or help yourself if you're at risk for disparities to get and seek the best possible care and understand why and what you can do to prevent disparities from happening. In addition, people who are in a position to make a difference, so these are people who impact health policy, or people who are our own legislators. It's important for all of us to know and recognize where these healthcare disparities come from and how we can create effective policies to prevent them from happening. There are many things that we know do make a difference as far as healthcare disparities go. For example, the kind of hospital you get treated at. Turns out that hospitals that have a huge burden of patients who don't have insurance, well, of course those hospitals are under a lot of strain. And in many cases, hospitals such as those that have a high proportion of uninsured patients, which are typically in inner cities, areas with a high proportion of minority patients as well, those hospitals, or many of them are called what are called safety net hospitals, they have a lot of pressure on their resources. And it's very difficult for those kind of hospitals to provide the kind of care that they would want to provide, or the kind of care you would be able to get if you go to a hospital that is extremely well funded and has a lot of money to spend and is able to really use resources to improve their quality of care and so on. So creating policies that help hospitals that are working in these kind of more difficult circumstances will make a difference. And those things will hopefully translate to decreasing healthcare disparities. And people who have the ability to do that, those are the people who really can help eradicate healthcare disparities. Scientists who provide data and provide information on policies that can help make a difference are extremely important in moving the conversation of healthcare disparities forward and really using science to make an important difference. The first barrier, in my opinion, is just not believing them. I'll tell you, the first time I ever spoke about healthcare disparities was about 6 or 7 years ago. And this was a large national conference of trauma surgeons. And I was presenting data showing that black children between the ages of 2 to 14 years of age, if they get hit on the head with a severe and end up having a severe injury, they end up having much worse outcomes compared to white children who are of the same age and who end up having very similar injuries. And I questioned, why is it that these black children were having worse outcomes compared to white children? And the whole group of trauma surgeons, listened. And I think most people were very concerned. But there was one person who stood up and was very upset and was mad at me, literally angry at me, for asking the question and for even raising the issue that maybe there's a disparity in care, and for even trying to investigate that, do we have a problem? He thought that by doing that I was somehow insulting doctors and surgeons who take care of patients. But I tried to explain to him that, if anybody, I'm looking at myself first. I work in Baltimore City. Most of my patients are from a minority group. Most of them happen to be black. And so if anybody, I'm questioning myself first. I try my best to give everybody the best possible care. But we need to figure out how we're going to make sure that that's occurring. And so I think that the biggest barrier to eradicating healthcare disparities is just not believing that they're there and trying to just turn a blind eye. So the way we're going to get rid of it is, I think, the following: creating good awareness, understanding the reasons why they occur, then creating effective solutions, and then creating policies that will make a difference.